Hello everyone. So the other night I watched a documentary about breastfeeding, and it reminded me of a little incident that I had when I first started breastfeeding. And that was when I was just pregnant. My sister-in-law said to me, the midwives, they just grab your boobs and grab your baby and they just sort of do it all. And I thought, oh my God, I'm not having anyone touch my boobs. These are mine. And I'm only sharing them with who, like my husband, like no one else is touching these. Yes, well, swallow your words, young lady. Lo and behold, when I was in hospital having just given birth, I actually had a drip in my wrist, and it was right on my right wrist, and any time I tried to bend it, it was just causing bruising, which meant that I was really struggling to use my dominant hand. And of course, my baby was on the right-hand side of me, so trying to get her out of the cot was really difficult to use my right hand, and even struggling to lean over and use my left arm to get her out. So getting her out of the cot was an issue, even to change her nappy. And then trying to latch, well, breastfeeding apparently doesn't come naturally to all women, and I was one of the people that I was just struggling with it. So I was just like, hey, here are my boobs, there's my baby, anyone, please just get this sorted out. And I just did not care anymore. Sub-midwives asked permission, can I touch your breasts? And I'm like, yes, please, just get this sorted. And yeah, because my breasts, when they were full of milk, they stopped becoming sexual part of my body. They just became a feeding machine for my baby. And so that was just an interesting sort of a backflip on what I'd said before. Now that I'm no longer back breastfeeding, these breasts have actually become mine and mine alone again, and I don't really want them on display. But when I was breastfeeding, they were just feeding. They weren't really a part of me. They were almost separate, and I struggled with trying to cover up and be discreet. And when I was at home and I had a friend visiting, a male friend, I just said, do you mind if I just breastfeed? And he was like, nah, I don't care. And I just did it there. And then I tried to be discreet, but I didn't have covers on me, and it was just so much easier. So I really feel for the women these days that are getting given a hard time trying to breastfeed in public when it is such a natural thing. The documentary that I was watching the other night actually talked about cross-feeding, and I thought that's really interesting. So cross-feeding is basically where you feed someone else's baby or someone else feeds your baby. Now, the benefit of this is if you're not able to breastfeed for whatever reason, and there are many mums out there who simply cannot breastfeed even if they want to breastfeed, and there are some mums that choose not to breastfeed, and that's their prerogative. But this is another option that I think is a really good one to consider. Basically, it's having a wet nurse, and wet nursing is something that is very historical. It's been around for forever, and for some reason now it's almost a bit frowned upon, which is a bit silly really, because breast milk is one of the best things you can give your baby, and breast milk is effectively the same whether it comes from yourself or someone else. And if you're a mother who overproduces milk and you're able to donate some, then that is possibly one of the best things you can do. And I personally would like to be able to do that, although breastfeeding with my daughter was not a fun experience. She was a bit of a snacker and a napper, so she'd snack for 10 minutes and then get distracted for 10 minutes, and feeding would take about an hour. So we struggled on for maybe 3 months, and then I'm like, oh, this is doing my head in. It takes way too long to breastfeed. I feel like I spend all my days just breastfeeding her, and I had no idea how much she was getting. So then I turned to expressing. Now, expressing worked way better, even though I totally felt like a cow being milked, but it was quicker, and then it was measurable, and I could see exactly how much she was having, and other people could feed her, and that gives a lot of enjoyment, particularly for the fathers, to be able to give your child their milk. So that's just a few options of what to do if you're not able to breastfeed, and some kids aren't able to have formula. Consider a wet nurse. It's perfectly natural, and if you think it's a bit icky, then watching this documentary, it was on ABC, I'm not sure what it was actually called because I kind of caught it by accident, but it was quite an eye-opener and really informative. So that's just an option if you don't want to walk down the formula track and you're not able to breastfeed yourself. So yeah, that's my tip for the day. Thank you very much for watching, and I will chat again soon. Thanks. Bye.